Welcome, guys. It's Talk Time Tuesday. Dr. Ashite and Dr. Dharma here to just talk about what's going on in our life, in our community, on um,
Mental health.
mental health.
All right, and remember, this is February,
Right.
so we're touching on all things Black History Month related, and African American health, minority health, health disparities. So we thought it appropriate to discuss depression and anxiety because this is actually a very important topic.
Yeah. And it's again, I know that we have like addressed it with you, but we see it like every day, patient after patient after patient. And so it comes to where the reason we do these Talk Time Tuesdays, besides to dress up and be fabulous, yeah, besides that, okay, is that we don't get to, I know, we don't get to spend time with y'all. Like, we literally have 15 to 20 minutes, and we're not able to really like spend as much time as we would love to with y'all. And we use this time between us to like visit with you, so that we can educate you on things that we would just love to sit there. And if we had the opportunity to do concierge medicine, where if you could afford a doctor that you could spend an hour with, and have all kinds of money, great, you should go get them. But most of us can't, and we use our health insurance, and in that way are limited. And so we want to give you access to us, and we want to be able to talk to you about things that we would be able to talk to you about, right? I mean, I think that's our objective. So depression and anxiety is a real thing post COVID. I mean, it was a real thing before COVID, but like after COVID, it's just been obscene because of the social isolation and because of what else? Just financial strain. Thank you. Yeah.
People are losing family members. I had one patient the other day, and I just couldn't believe it. She had 5 different people who were very closely related to her who had passed from COVID.
Yeah.
And it's just it's a lot. It's a lot. So yeah. Multiple reasons.
And so I know some of you follow us on Nagging Doctor, and I know I'm always talking about exercise. And even when I was really sad with my brother, there were so many times that I would just go outside and walk, and I would just force myself to engage in some form of movement. So even at the lowest point in my life, I did what I talked to y'all about. And I think, that I think really means something. So when we're sitting here and we're just talking about stuff, it's easy to preach to people until that moment occurs. And when that occurs, are they the people that they say they are? Well, yes, we are. You see her exercising all day, every day. You see me at my CrossFit gym, and you see that, what we try to like allow y'all to learn from us is the things that we use to be resilient and to survive Dr. Burnout. I mean, anyone can have depression and anxiety. And we're going to talk about those topics specifically and what we can do, but specifically we wanted to highlight and showcase African Americans because there's so much stigma involved in even the word depression, even feeling sad. And I would want to start saying and talking about the fact that a lot of times they'll say, well, I've been praying about it. And I mean, I think that is really important because prayer is helpful. And prayer is something that we lean on when we feel down. And so, yes, but it is not mutually exclusive of other modalities and other things that you can do to feel better that have been, well defined and will give you results faster. So the reason people come to us is because when you have an issue, you can try all these things at home, and that's great. But by the time you come to us, you want to see results, and we want to give you results. And so what can we advise you or teach you that can really make a difference? So what are some of the things that you talk and walk patients through, and obstacles, especially with African Americans, to help them feel better when they're suffering with anxiety and depression?
I think one of the biggest things first, is the denial, right? So there's huge denial in what that depression even exists or is even there,
Mm-hmm.
you know. And one of the signs that you can actually tell that you're depressed is if you stop caring, you know, if you used to take your medication and cared what your blood pressure was or how well your diabetes was controlled, but then all of a sudden, you know, you don't care to take your medication or be as consistent, that can be a sign. Sometimes for me, when I see what we call quote unquote non-compliance, you know, if I see it and I've seen you a couple of times and we're still not passing by that taking the medication, I always have to be like, okay, is there something else going on? Because sometimes depression, the main symptom may not be the sad, so you may not feel like you're sad or crying all the time, but it may be this overwhelming lack of motivation, right? So the first thing is acknowledging that it exists, right? And then I also try to normalize it, right? That if you're part of the human race, then it can happen to you too.
Yeah.
And accepting that. Now, if you've got some superpower or something that we don't know about, then maybe it doesn't apply to you. But as long as you're human, then yes, it can happen to you as well. So starting there, and we don't have to be heroes. Like at some point in our lives, I'm going to be stronger and be able to pull someone up. At some other time, you're going to be able to be stronger and pull someone up. And it's okay to get help. I had a patient say to me, you know, it was hard for them to accept and deal with their depression because they thought of their father who had passed, who always told them that they were a strong woman, you know. And so to accept a definition or a diagnosis of depression and have to seek help meant that they weren't strong anymore. But the truth is, accepting help does not mean that you're no longer strong, you know. There is a lot of strength in being able to accept that you have a problem and taking the step to get the help. And so a lot of times for, you know, my population, my African American or minority population, trying to normalize depression and anxiety is a starting point, you know. And with anything, as with anything, if you can't accept it, then there's no way forward, right? If you've got an addiction, if you can't accept that you drink a lot of alcohol more than you're supposed to, you know you are, you know, then if you can't accept that there is a problem, then treatment becomes hard. We've talked about the treatment, you know, we believe in natural remedies, you know, if it can't, you know, and that's why the clinic invests so much in having, you know, Dr. Holly and our other counselors available. That's why we have the exercise programs through, you know, Trainer Kristen available to help our patients move. You know, all of these modalities are there, they're strong. We try to get patients supplements sometimes, L-theanine through our Las Colinas, you know, pharmacy, so you don't feel like you're taking a medication. But when it is necessary, we will prescribe it for you. But more than anything, we're also here to kind of, you know, walk you through. Sometimes patients come to me and their whole visit is really just talking things through, you know. And so that acceptance part is key, you know. It's not a failure. It's not something that you just snap out of. You know, the same way that you can injure your knee. If you believe that you have a brain, you better believe it that the brain can get sick too. You know? I really wish and pray for the day when we'll be able to like use a thermometer or something like a brainometer. You're like, yep, you're depressed, and you show it to the patient like, yep, doctor, I'm
that's
depressed.
A really
you know?
interesting point that you bring up, because a lot of times when you can do a blood test, then someone will believe it. But unfortunately, with depression, we're just at the cusp of understanding. So right now they are doing biomarkers, but they're more in trials, so it's not something in regular medicine. But they are checking and seeing, well, what are you actually low in? I know we've talked about the fact that serotonin is a brain hormone, neurotransmitter that is released, and when you are low in that, that's what we supplement, you know. And so we've talked about that, but we can't check that. There are some urinary tests to check for it, but they're not covered under your insurance, and they're not standardized, and we're not able to like tell really whether or not it's an accurate indicator of whether you're depressed. So how we diagnose depression is clinical, right? And that's what a doctor does, is they're trained to be able to sit with you, and based on your symptoms, whether it's a rash or whether it's chest pain or whether it's how you feel, we're able to then give you a diagnosis and then the treatment options. And so, yeah, we don't have a blood test or a brain MRI that can tell you right now whether you are clinically depressed or not, but we can clinically diagnose you, okay? Now, you said something else, so that was, I think, really an important factoid. So acceptance, and then how do you get diagnosed, and then moving to treatment. And so, yeah, nobody wants to be on a pill, a happy pill. Nobody wants that, all right? I mean, that's like my big obstacle that everyone goes through. And I get that. That's why, as she said, we have all these other things that have been proven to help with mild to moderate depression, such as counseling, even journaling. And then let's not forget exercise. You know, I mean, I talk about it all day, every day, and you would think that I completely love to exercise. You know, I don't. I mean, it's a struggle for me, just like everyone else, to kind of find the time to do it in my day. But, you know, I do know that if I don't, then these are going to be the things that happen to me. And so I choose to, you know, invest in exercise over other things. But I'm a big believer in exercise, especially for mental health. And then being outside, I think that really makes a big difference when you exercise. And these things have been like proven. So it's not like, oh, Dr. Dharma thinks. No, this is like science, and there's evidence behind it. But then when you come to a pill, you know, yes, it's a pill. It's not a forever pill, right?
Right.
It is for a time. And my favorite way of describing this is that when you deplete your bank account of serotonin, so let's say you have $1,000 saved of serotonin and your car breaks down, you end up having someone die on you, you have to move, your husband leaves you, you know, you are now negative 500. So you went through your 1,000 and you actually depleted, even, you know, you are like in the negative. So you're completely depleted. And so if you put $1 a day in of serotonin into your bank account, then you come up to neutral, and then you go to 1,000, and we want to try to get you to $2,000 of serotonin, so that then when we take you off the medicine, we have given you enough savings to last you, and so that then you can continue to exercise and eat healthy and go to counseling, but you have a base that will hold you, so that you can keep going. And it, like I said, it's not forever. That's kind of how I explain to my patients, you know, when you're down without enough hormones, we give you the hormones for a certain period of time, and then you feel better and we can get you off, you know? And so do you have any, what do you kind of?
I mean, it's the same thing. A lot of times people, I get this question and this fear a lot. People feel like taking the medication will make them forever dependent on it.
Oh yeah, dependent.
As though it's
addiction.
Right, exactly. Yeah. But it's also, when I listen to the way they say it, it's almost as though there's a belief that the medication is going to change something about them, such that they would always need the medication. And that is not the case. The medication is helping you. If it turns out that when we come off you still need it, it's not because the medication did that to you. It's because you haven't fully repleted your stores yet, like you said, right? But it's, you know, the medicines that we use to manage depression do not change you to need them forever, you know, and we can safely, with the help of your clinician, take you off of them when it's time to come off.
Right.
Yeah.
So, if you are feeling some kind of way, meaning if your sleep is off, either you don't want to get out of bed because you just can't deal with it, or you're sleeping not at all, like you just worried, and you're waking up at 3 o'clock in the morning. 2 or 3 is when usually people will wake up, starting to worry and feeling stressed out. If your energy is low, if you are eating too much, if you're like, you know, emotionally eating, or just can't even, you don't even feel like touching food. If you feel guilty and upset about whatever it is that's just going over in your mind like a tape recorder over and over again. if your interest, like if you're doing something that you love, like gardening or skiing or whatever, and you're just like, I don't even want to be here. This doesn't give me any joy or pleasure anymore. Whatever.
If you have those symptoms,
Yes.
no matter what your race, ethnicity, background is, and you've had it for a while and it's not going away. So we're not talking about you had these symptoms for a week and then you're good. But if you have this prolonged, then you most likely have depression.
Clinical depression.
Clinical
Not
depression.
I'm sad my dog died depression.
Right.
Because that, I wish they didn't use that word, because clinical depression is not the same like, oh, she's depressed,
Right.
because
Yeah.
her boyfriend left her,
Right.
Yeah.
Yeah.
So that's a big differentiate. Like we define depression as a certain set of symptoms.
That have happened for a specific period of time.
Correct.
Yeah, consistently. So if you're having this and you're feeling like you can't snap out of it, quote unquote,
Mhm.
don't suffer alone. Seek
Please.
help. We're here for you.
Yeah. All right. We'll see you again on Talk Time Tuesday. As always, you can reach out to either one of us or to the clinic. We want to educate you so that we can continue to help you as much as we can during these times. All right.
Bye. Bye.